2.1 Initial Responses, Alex Lees. In this video I'm going to be doing the respiratory system. Ventilation. This is respiratory responses. Ventilation increases to adapt to the changes and demands of exercise. This is done by increasing the tidal volume, which is the amount of air that is inhaled and exhaled in one breath. At rest, you can see that all of the values are very low, around 20 litres per minute. This is for the graph on the right hand side. But prior to this exercise, this will rise slightly due to possibly doing exercise. This is known as the anticipatory rise. The light exercise is a gradual increase, then plateaus off and drops back down to resting level. The moderate exercise is a much more heavier increase in ventilation. It then plateaus off but is still slowly increasing, then a rapid decrease followed by a gradual decrease to get back to the resting levels. In heavy exercise, there is an even bigger increase where you are working maximally up to around 120 litres per minute. This then will keep going since there is no stopping until the exercise has fully stopped and go into a very sharp decrease followed by a gradual decrease back to resting levels. Ventilation. Here we are going to do respiratory dynamics. Here is an equation for respiratory dynamics. And that equation links to ventilation, which is VE, breathing rate times tidal volume. VE stands for minute ventilation. The BR stands for breathing rate, and TV stands for tidal volume. At rest, minute ventilation is around 6 litres per minute. However, when we exercise, this can increase to around 90 litres per minute. This is the same for tidal volume, as at rest it is 0.5 litres, but when you exercise that can increase to around 3 to 4 litres. Breathing rate also goes through the same changes as ventilation and tidal volume go through. At rest, breathing rate is around 12 breaths per minute, but when you exercise that increases to around 30 to 40 breaths per minute. In figure 1, you can see the test results for the bleep test breathing rate. At the pre-test, there is a little bit of breathing because they have done some exercising, like a warm-up or just a warm-up, and another thing called anticipatory rise has taken place. This is where your breathing rate will slightly increase in anticipation of you doing some exercise. There is a steady increase in the breathing rate from L2 to L8. At the end of the test, their breathing rate is at 52 breaths per minute, which suggests they are working at a very intense level on the RPE scale. On the spirometer trace graph, the total lung capacity is the total amount of air the lungs can hold. This is around 6 litres. There is a little bit of air left in our lungs as a protective barrier to stop our lungs from collapsing. This is called the residual volume, and this is around 1.2 litres of air in our lungs. The vital capacity can be measured through a Douglas bag, which is a very large plastic bag. This is usually around 4.5 to 5 litres of air that can be breathed out. The inspiratory reserve volume is a backup of air. This is around 3 litres of air. The tidal volume can differ from 0.5 litres to as big as your vital capacity, which is around 4.5 to 5 litres of air. Forced breathing mechanics and control. There are different processes that happen during inspiration during exercise and expiration during exercise. The movements that happen in inspiration are the external intercostal muscles and the diaphragm. Both contract due to a larger impulse being sent from the respiratory control center. There are lots of muscles involved in inspiration, but the main one is external intercostal muscles and diaphragm, but there are some external accessory muscles called the sternocleidomastoid, scalenes, and the pectoralis major. As you breathe in, the volume will increase due to your thoracic cavity expanding quite a lot. This will decrease the pressure relative to the atmosphere. The airflow will flow in a lot quicker due to you breathing in more heavily in a shorter amount of time. The expiration is pretty much the same, but just like the opposite. The diaphragm and external intercostal muscles relax, and the thoracic cavity moves in and down. The internal intercostal muscles make the ribs go back to their normal position. The muscles, these are just the normal diaphragm, external intercostal muscles, but there are some different ones as well, which are the internal intercostal muscles, and there are some accessory muscles which help pull in the thoracic cavity, which is the rectus abdominis and the latimus dorsi. The volume is reduced at a bigger rate due to you breathing in less. The volume is reduced in a bigger rate due to you breathing in more air and you breathing it out a lot faster. The pressure increases at a more rapid rate because of you constantly breathing in and out. More air is forced out faster, so you would just breathe out a lot of air. The Herring-Brewer reflex is a reflex triggered to prevent the overinflation of the lungs. The pulmonary stretch receptors on the wall of the bronchi and bronchioles of the airway respond to the stretching of the lung during large inspirations. The VRG, or ventral respiratory group, is the main factor in exhalation, in that it will send an impulse to the diaphragm and external intercostal muscles to force them to compress the thoracic cavity, therefore forcing any air out into the atmosphere. The Valsalva maneuver. The Valsalva maneuver is performed by moderately forced attempt exhalation against a closed airway. This is usually done by closing your mouth and pinching your nose shut while expelling out air. The Valsalva maneuver is named after a 17th century Italian physician Antonio Maria Valsalva. He was the first person to really explain it and really find out about it. The Valsalva maneuver can be applied to everyday activities such as trying to equalize the pressure in your ears. It can also be applied to many different sports such as rugby or diving. In rugby, the Valsalva maneuver can be used to prepare your body for an incoming tackle. Or in diving, it would be used to equalize the pressure in your ears. When your muscles are working harder, they are also burning more calories. Your muscles need more oxygen than they normally use to burn these extra calories. Your blood picks up oxygen as it travels through your lungs and delivers it to the muscles you are using. As your level of activity increases, your breathing rate increases, bringing more oxygen into your lungs so they can pump more oxygen around and out to your muscles. At rest, in figure 1, the breathing is relatively low at around 12 breaths per minute. This is the normal resting level of breathing rate. The pretest is where something called the anticipatory rise will occur. This is where the body will slightly increase breathing rate in anticipation of exercise occurring. This is good as it prepares your body for a big maximal activity. At rest, both figure 1 and figure 2 are normal resting values for breathing rate. pre-test is relatively the same as the multi-stage fitness test. Is the same as multi-stage fitness test, whereas the Wingate is also the same, a little bit less at 20. This post-test is the same, but it is interesting to see how over 15 minutes the breathing rate is the same as 20-second Wingate test. This is interesting as it shows how intense even the 20-second Wingate test actually is, since the breathing is relatively the same. In a football match, there are many different applications of breathing that would cause it to be different. For instance, a low breathing rate would be used when you would just be watching someone making a tackle. You are watching a person making the tackle, so your breathing rate would be a resting level, or it would be slightly increased, but it wouldn't be anything too major. This would raise to around a moderate level when that person you are watching fails to make the tackle and you need to run back into position and jockey the ball to stop the attacker from getting past you. This is a good example since you are moving quite a bit but not enough for your breathing to be overly heavy. You won the ball back and now you make a tackle and pass the ball to the attacker. The sprint that you're going to make is a good example of high breathing rate since you have no time to properly inflate your lungs, so you're trying to get as much oxygen into your body as possible in a shorter time as possible. That is the respiratory system.